Last week, Margaret, a 68-year-old grandmother, nearly drove through a red light. She didn't see it. 3 months earlier, John couldn't recognize his own daughter's face across the dinner table. And just yesterday, Susan fell down her own stairs because she misjudged the first step. What do all three have in common? A vision problem that could have been prevented, or at least managed, if they had known the warning signs. And here's what worries me most as a physician. Many of my patients come to me only after they've already lost significant vision. Vision that, in many cases, we could have saved. So if you've noticed that street signs seem harder to read, or colors don't look quite as bright as they used to, or you're having trouble seeing at night, this video might just save your sight. Stay with me, because I'm going to walk you through exactly what's happening to your eyes, the warning signs you absolutely cannot ignore, and most importantly, the specific steps you can take starting today to protect your vision for years to come. Section 1. Understanding the problem. Let me start by being completely honest with you. After age 60, your risk of serious vision problems doesn't just increase a little, it multiplies. And I need you to understand why this happens, because when you understand what's going on inside your eyes, you'll be much more motivated to take the steps I'm going to share with you. Why vision deteriorates with age. Your eyes, like every part of your body, age, but here's what makes eye aging particularly concerning. Many of the changes happen so gradually that you don't notice them until significant damage has already occurred. Let me explain the 4 main ways your eyes change as you age. First, the lens inside your eye becomes less flexible. Think of your eye's lens like a camera lens that needs to focus. When you're young, this lens is soft and flexible, easily changing shape to help you see both near and far. But as you age, it becomes harder and stiffer. This is why almost everyone needs reading glasses eventually. This condition is called presbyopia, and while it's normal, it's also just the beginning. Second, less light reaches your retina. By age 60, your pupils don't dilate as widely as they used to. This means only about 1/3 of the light that reached your retina at age 20 gets through now. This is why you need brighter lights to read, why driving at night becomes more difficult, and why you might trip over things in dim lighting. Your eyes simply aren't receiving enough light to see clearly. Third, your eyes produce fewer tears. Dry eye syndrome affects more than 40% of people over 65. Your tears aren't just for crying, they're essential for clear vision. Every time you blink, tears spread across the surface of your eye, creating a smooth optical surface. When you don't produce enough tears, or they evaporate too quickly, your vision becomes blurry, your eyes feel gritty, and you become more susceptible to infections. Fourth, and this is critical, your risk of serious eye diseases increases dramatically. Conditions like cataracts, glaucoma, macular degeneration, and diabetic retinopathy become much more common after age 60. These aren't just inconveniences. Left untreated, they can lead to permanent, irreversible vision loss. Section 2. The major vision problems seniors face. Now, let me walk you through the specific vision problems you need to watch for. I'm going to give you the warning signs for each one, because early detection is absolutely crucial. Cataracts, the cloudy lens. Cataracts are the leading cause of vision loss in people over 60. By age 80, more than half of all Americans either have a cataract or have had cataract surgery. But here's the good news. Cataracts are treatable. Here's what's happening. Inside your eye, you have a clear lens that focuses light. With cataracts, this lens becomes cloudy, like looking through a foggy window. The cloudiness develops slowly, usually over years, which is why many people don't realize how bad their vision has become. Warning signs you cannot ignore. Colors seem faded or yellowed. Reds look orange. Blues look gray. You see halos around lights. Especially at night when driving. Reading requires brighter and brighter light. Your glasses prescription keeps changing, but new glasses don't seem to help. Glare from sunlight or headlights becomes increasingly bothersome. Double vision in one eye. If you're experiencing 2 or more of these symptoms, you need to schedule an eye exam. Don't wait. While cataracts aren't an emergency, the longer you wait, the harder they become to remove surgically. Glaucoma, the silent thief of sight. This is the one that keeps me up at night, because glaucoma is called the silent thief of sight for a reason. It steals your peripheral vision so gradually that most people don't notice until they've lost significant, irreversible vision. Listen carefully. By the time you notice symptoms of glaucoma, you may have already lost up to 40% of your vision. Glaucoma occurs when pressure builds up inside your eye, damaging the optic nerve, the cable that sends visual information to your brain. Once those nerve fibers are damaged, they cannot regenerate. Warning signs, and here's the problem, there often aren't any early warning signs. Gradual loss of peripheral vision, side vision in both eyes. In later stages, tunnel vision, sudden eye pain. This is acute glaucoma, a medical emergency. Blurred vision, seeing rainbow-colored halos around lights, nausea and vomiting along with eye pain. Because early glaucoma has no symptoms, regular screening is essential. If you're over 60, you need a comprehensive eye exam with pressure measurement at least once a year. If you have a family history of glaucoma, diabetes, or are African American, you're at higher risk and may need more frequent screenings. Age-related macular degeneration, AMD, the center vision destroyer. AMD is the leading cause of severe permanent vision loss in people over 60. It affects the macula, the central part of your retina responsible for sharp, detailed vision. When the macula deteriorates, you lose your central vision, making it impossible to read, recognize faces, or drive. There are 2 types: dry AMD, which progresses slowly, and wet AMD, which can cause rapid vision loss. Wet AMD is a medical emergency. Warning signs: straight lines appear wavy or bent. This is often the first sign. A dark, blurry area or whiteout appears in the center of your vision. Colors seem less vivid or bright. Difficulty recognizing faces. Need for increasingly bright light when reading. Difficulty adapting to low light levels. Here's a test you can do right now. Cover one eye and look at a door frame or window frame. Are the lines perfectly straight, or do they appear wavy or bent? Now, test the other eye. If lines that should be straight appear distorted, you need to see an eye doctor within days, not weeks. Diabetic retinopathy. When blood sugar damages vision. If you have diabetes, and 1 in 4 Americans over 65 do, you're at risk for diabetic retinopathy. High blood sugar levels damage the tiny blood vessels in your retina. In early stages, these vessels leak fluid or blood. In advanced stages, abnormal new blood vessels grow on the retina's surface, which can lead to severe vision loss or even blindness. Warning signs: spots or dark strings floating in your vision, floaters, blurred vision that comes and goes, fluctuating vision, dark or empty areas in your vision. Vision loss. If you have diabetes, you must have a comprehensive dilated eye exam at least once a year, even if your vision seems fine. This is non-negotiable. Diabetic retinopathy can be treated effectively if caught early, but once vision is lost, it's often permanent. Section 3. Other common vision problems. Dry eye syndrome. More than a minor annoyance, chronic dry eye can actually damage your cornea and affect your quality of life significantly. Symptoms: stinging, burning, or scratchy sensation in your eyes, stringy mucus in or around your eyes, sensitivity to light, eye redness, a sensation of having something in your eyes, difficulty wearing contact lenses, difficulty driving at night, watery eyes. Yes, dry eyes can cause excessive tearing. Your eyes produce poor quality tears that don't lubricate properly, triggering excess tear production, blurred vision or eye fatigue, floaters and flashes. Most floaters are harmless. They're tiny clumps of gel or cells inside the vitreous, the clear gel-like fluid that fills your eye. However, a sudden increase in floaters, especially if accompanied by flashes of light or loss of peripheral vision, can signal a retinal tear or detachment, a true emergency. When to seek immediate care. Sudden increase in the number of floaters, flashes of light in one or both eyes, a shadow or curtain over part of your visual field, sudden decrease in vision. If you experience any of these, go to an emergency room or eye doctor immediately. A detached retina needs to be treated within hours to prevent permanent vision loss. Section 4. Protecting your vision. Actionable steps. Now, here's what you've been waiting for. Exactly what you need to do to protect your vision. I'm going to give you specific, actionable steps you can start implementing today. Step 1. Schedule regular comprehensive eye exams. This is the single most important thing you can do. Notice I said comprehensive eye exam, not just a vision screening. A comprehensive exam includes visual acuity testing, pressure measurement to screen for glaucoma, dilated eye examination. Yes, the drops that make your eyes sensitive to light for a few hours. They're essential because they allow your doctor to see the back of your eye. Peripheral vision testing, examination of the optic nerve, retinal examination. If you're over 60 with no risk factors, you need a comprehensive eye exam every 1 to 2 years. If you have diabetes, a family history of eye disease, high blood pressure, or are taking medications that can affect your eyes, you need annual exams at minimum. Don't skip these exams because your vision seems fine. Remember, many serious eye diseases have no early symptoms. Step 2. Control your blood sugar, blood pressure, and cholesterol. These 3 factors have an enormous impact on your eye health. Let me explain why. Blood sugar. High blood sugar damages the blood vessels in your retina. If you have diabetes, keeping your A1C below 7% can reduce your risk of diabetic retinopathy by up to 76%. Check your blood sugar regularly, take your medications as prescribed, and follow a diabetes-friendly diet. Blood pressure. High blood pressure can damage the blood vessels in your retina, leading to a condition called hypertensive retinopathy. It also increases your risk of stroke, which can cause vision loss. Keep your blood pressure below 130/80 if possible. Cholesterol. High cholesterol can lead to deposits in the blood vessels of your eyes, affecting your vision. It also increases your risk of retinal vein occlusion, essentially a stroke in your eye. If you're not monitoring these regularly, schedule an appointment with your primary care doctor this week. Step 3. Eat for eye health. Your diet directly impacts your vision. Certain nutrients are especially protective for your eyes. Dark leafy greens, spinach, kale, collard greens. These are loaded with lutein and zeaxanthin, antioxidants that concentrate in your macula and protect against AMD. Aim for at least 1 serving daily. Fatty fish, salmon, mackerel, sardines, and tuna are rich in omega-3 fatty acids, which support retinal health and may help prevent dry eye syndrome and AMD. Try to eat fish at least twice a week. Colorful vegetables and fruits, carrots, sweet potatoes, squash, oranges, and berries contain vitamin A and vitamin C, both crucial for eye health. Vitamin A deficiency can actually cause night blindness. Nuts and seeds, almonds, walnuts, and sunflower seeds provide vitamin E, which may slow the progression of AMD. Eggs. The yolks contain lutein, zeaxanthin, and zinc, all protective for your eyes. Consider this. Multiple large studies have shown that people who eat a diet rich in these nutrients have a significantly lower risk of developing AMD and cataracts. Step 4. Protect your eyes from UV light. Here's something many people don't realize. UV exposure doesn't just damage your skin, it damages your eyes too. Cumulative UV exposure over your lifetime increases your risk of cataracts, macular degeneration, and even eye cancers. What you need to do? Wear sunglasses that block 99 to 100% of UVA and UVB rays whenever you're outside. Even on cloudy days, wear a wide-brimmed hat for additional protection. Never look directly at the sun. Be especially careful around water, snow, and sand, which reflect UV rays. And please, don't buy cheap sunglasses that don't provide UV protection. Dark lenses without UV protection are actually worse than no sunglasses at all because your pupils dilate in the darkness, allowing more UV light to reach your retina. Step 5. Quit smoking. If you smoke, quitting is one of the most important things you can do for your vision. Smoking doubles your risk of developing cataracts and increases your risk of AMD by 2 to 3 times. It also contributes to diabetic retinopathy and dry eye syndrome. I know quitting is difficult. I've had this conversation with hundreds of patients. But the vision-protecting benefits begin almost immediately after you quit. Talk to your doctor about smoking cessation programs, nicotine replacement therapy, or medications that can help. Step 6. Manage dry eyes. For dry eye relief, use artificial tears. Not the ones that get the red out. Those actually make dry eye worse. Use preservative-free lubricating eye drops. Apply them proactively, even before your eyes feel dry. If you need to use drops more than 4 times a day, use preservative-free varieties. Take breaks from screens. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. When you stare at screens, you blink less frequently, allowing tears to evaporate. Use a humidifier, especially in winter when indoor air is dry. Keep humidity levels between 30% to 50%. Stay hydrated. Drink plenty of water throughout the day. Omega-3 supplements. Studies suggest omega-3 fatty acids can improve dry eye symptoms. Talk to your doctor about taking a fish oil supplement. Step 7. Improve your home lighting. Since your eyes receive less light with age, you need to compensate. Use brighter bulbs, at least 60 to 100 watts equivalent, in areas where you read, cook, or do detailed work. Install task lighting for specific activities like reading or hobbies. Use nightlights in hallways, bathrooms, and bedrooms to prevent falls. Reduce glare by using lampshades and positioning lights to avoid reflection on TV or computer screens. Paint walls in lighter colors to reflect more light. Keep windows clean and curtains open during the day. Step 8. Update your glasses prescription regularly. Even if you think your glasses are fine, your prescription may have changed. An outdated prescription forces your eyes to work harder, leading to eye strain, headaches, and fatigue. Have your prescription checked annually, and always get new glasses if your prescription changes, even if the change seems small. Step 9. Exercise regularly. Regular physical activity reduces your risk of developing conditions that can harm your eyes, including diabetes, high blood pressure, and high cholesterol. It also improves blood circulation to the eyes and may lower eye pressure in people with glaucoma. Aim for at least 30 minutes of moderate exercise most days of the week. Walking counts, gardening counts, swimming counts. Find something you enjoy and do it consistently. Step 10. Know your family history. Many eye diseases run in families. If a close relative has glaucoma, macular degeneration, or other eye disease, your risk is higher and you may need earlier or more frequent screening. Write down your family eye health history and share it with your eye doctor. This information can be crucial for early detection. Section 5. Warning signs that require immediate action. Before we finish, I need to make absolutely sure you know which symptoms require immediate medical attention. These are true eye emergencies. Seek emergency care immediately if you experience sudden vision loss in one or both eyes, sudden blurry vision that doesn't clear with blinking, flashes of light or a sudden increase in floaters, a curtain or shadow moving across your field of vision, eye pain that doesn't go away, double vision that comes on suddenly, eye injury, chemical exposure to the eye. With these symptoms, minutes matter. Don't wait until morning. Don't call your regular eye doctor and wait for a callback. Go to the emergency room or an urgent eye care center immediately. Let me bring this all together. Your vision is precious, and unlike many things that decline with age, vision loss is often preventable or treatable, but only if you take action early. The 5 most important takeaways from today's video. 1. Get regular comprehensive eye exams. This is non-negotiable. Many serious eye diseases have no symptoms until significant damage has occurred. 2. Know the warning signs. If you notice changes in your vision, blurriness, distorted lines, difficulty seeing at night, increased floaters, or any of the symptoms we discussed, don't ignore them. See your eye doctor promptly. 3. Control your overall health. Blood sugar, blood pressure, and cholesterol all directly impact your eye health. Take your medications, eat well, exercise, and quit smoking. 4. Protect your eyes daily. Wear UV-blocking sunglasses, use proper lighting, take breaks from screens, and use lubricating drops if you have dry eyes. Never delay seeking emergency care for sudden vision changes. When it comes to your eyes, time is vision. Acting quickly can mean the difference between treatment and permanent blindness. I know I've covered a lot of information today, but here's what I want you to do right now. If you haven't had a comprehensive eye exam in the past year, pick up your phone and schedule one today. Don't wait until next week. Don't wait until your vision seems worse. Do it now. Your future self, the one who can still read, still drive, still recognize loved ones' faces, still enjoy all the visual pleasures of life, will thank you. If you found this video helpful, please give it a thumbs up and share it with someone you love who might need to hear this message. And if you're not already subscribed to Dr. Carter's Senior Health Guide, click that subscribe button. I post new videos every week with practical, evidence-based health advice specifically for seniors. Take care of those eyes. I'll see you in the next video.